If you find yourself struggling with your posture, especially when you're sitting for prolonged periods of time, then you are suffering with what we call buzzard neck. It's kind of a funny title, but if you think about how the buzzards sit with kind of their head forward from their shoulders, you can kind of see like, yeah, that actually makes sense. Now, if that's what you're suffering with, today's video is for you. I'm Dr. Amy, PhD trained orthopedic manual physical therapist, and I am empowering women with changing bodies to move pain-free. And let me tell you, friends, there is nothing more important than working on your posture, especially if you find yourself in a work environment where you need to maintain a prolonged sitting or standing posture for a long period of time. Not dealing with posture issues early enough can really lead to chronic conditions later on. And make sure you stay around to the end because I'm going to give you some of my favorite exercises that you can do while you're sitting or standing to improve your posture right where you are. Now, a lot of people know that their posture maybe isn't the best, or perhaps it gets worse throughout the day. If you're sitting for a prolonged period of time, or even standing for a prolonged period of time, it can be hard to keep that proper posture. However, it is super important because when everything is stacked up, we can make sure that we're getting that diaphragm activation, which allows for a normal breathing pattern. When we get into the poor posture, or more of that slunched forward position, it's difficult for that diaphragm to be able to do the breathing that we need, and we get increased tension in the shoulders. You may find yourself with increased neck tension or shoulder tension if you sit for prolonged periods of time, and often that's because over time we kind of slouch down and things become more challenging. It's especially important to deal with this issue now because if not, that can lead to other issues later on. So a lot of people struggle in their later years with degenerative joint disease in their neck or disc issues in their neck, or they lose motion or strength through their upper quarters. So that would be the neck and the shoulders. And a lot of this can be due to chronic poor posture over time. So it may not feel like it's a huge issue now. It may not be causing pain now. You may not have these symptoms now, but dealing with it now can keep those symptoms from coming on later on. Because once you have the pain, it becomes way more difficult to get rid of it. The next logical question is, what is the best posture? I've had a lot of patients come into the clinic and they've watched different videos and they're like, okay, I keep my shoulders back and I keep my back straight and really try to keep that military posture. But military posture is actually not what we're going for. That's not actually allowing that normal spinal curvatures that we're supposed to have in our spine. You see, a normal spine has a curve that goes in your neck, goes out in your back a little bit, not too much, but a little bit, and then in your low back. So what we really want to do is be able to get into that correct posture. You can do that right now where you're sitting, as long as you're sitting on a firm surface. If not, go ahead and grab a chair that's a little bit firmer to make sure that you have a good base to work on. And what you're going to do is just go back and forth, rocking back and forth on your sit bones. So your sit bones are the bones that you're sitting on, right? And you can feel yourself rocking back and forth on them. And as you do that back and forth motion, make sure it's not pain-free when you're doing it, just go as far as you can pain-free. You can find a spot where everything seems to line up, where your shoulders are over your hips and your head is able to rest over your shoulders. That is the ideal posture. That allows your body to have those normal spinal curvatures and decrease the muscle tension to maintain that posture. Now, if you're sitting for a long period of time, you may need some support. So some people like to use that lumbar support in their low back because it helps them to stay in this position. But you don't want to use a lumbar support and then kind of push your body into that position. Just use it to give you that cueing to maintain that good posture. Now, a lot of people also ask me, where should my knees be in relation to my hips? So a lot of people think that the knee, let's say this is the knee here, right there, should be straight out from the hip. And that can be okay, but what I find to work better for people, especially who sit at a desk all day, is to have your hips slightly higher than your knees. The reason why is because it helps to get you into that better posture. It kind of pushes you forward. We call that an anterior pelvic tilt. And then it makes it easier to maintain this good posture throughout the day. It's not that having your knees and hips level is bad. It's just that having your hips a little bit higher than your knees can make it easier to maintain that good posture. Now, another problem that people can have is if they don't have an armrest on their chair, they can get a lot of stress and tension through their shoulders because over the day they just kind of start creeping up on them. So if you do not have an armrest, somewhere where your elbows can rest down, then I'm going to recommend that you get a wrist rest, so something that goes underneath your wrist in order to rest your wrists on. You need to have some support through the upper body so that, again, those shoulders don't start creeping up. You want to make sure that the wrist rest height is high enough that you can still have your wrist in a neutral or slightly forward bent position. You don't want to have a wrist rest and then you have to be up in here in order to do your typing throughout the day. If you sit for a prolonged period of time, definitely finding the right chair is incredibly important. Some things to look for are to make sure that the seat pan is adjustable, so that's where you sit. You want to make sure that it can go up and down. I also like it when it can tilt a little bit forward, because again, it can help you with that anterior pelvic tilt, which allows your spine to line up on top. For most people, I do recommend having that armrest so your elbows can be resting down and allowing your wrist to be in that neutral position. Now, even the best chair and even having the best posture can still be difficult to maintain for a prolonged period of time. So if you are somebody who sits and works at a desk, or you're somebody even who's in a standing posture for long periods of time throughout the day, then I recommend having some exercises, some tools on hand that you can do throughout the day in order to decrease the tension, especially through the neck and shoulders. That's usually where people will feel this buzzard neck first. So here's some simple things that you can do while you're at your desk or if you're standing for prolonged periods of time. The first one is going to be a chin tuck. So you're going to take your chin and you're going to tuck it back as far as you feel comfortable with. This should not be painful. It may cause a stretch sensation, which is okay, but it definitely should not cause a pain sensation. So make sure when you're tucking that chin back, you're getting that nice length through the spine. You should feel like you're getting a little bit taller as you're tucking that chin back. It can be difficult to know if you're doing this correctly. So often when I have people start doing it, I'm going to have them do it up against the wall so that way they can feel that input of, oh yeah, I feel that lengthening in my neck. You want to do that for 10 to 15 reps or until you feel like your neck has decreased tension. All right, another great one to get those shoulder blades moving and decrease some tension through your shoulders is called scapular retractions. So what you're going to do is you're going to squeeze your shoulder blades back together, which is going to cause your chest to stick out, and then you're going to relax. This is a squeeze those shoulder blades together and relax. And I like to leave my hands in my lap so I don't have to support them. However, if you want to put your arms down by your side because you feel like that helps increase your motion, that's absolutely fine. Some people will even like to have their elbows bent so that their elbows can help them squeeze a little better. If you have difficulty doing this with your arms down by your side or resting in your lap, that can be really helpful to help get those shoulder blades moving. And again, you're going to do about 10 to 15 reps or until you feel those muscles are stretched out. One of my favorite exercises to do is a simple shoulder shrug, and I do these throughout the clinic all day long just because I'm working on patients and I'm, got that hands-on physical therapy, so my shoulders can get tight sometimes. So for this one, you're going to bring your shoulders up to your ears as far as you feel comfortable with and just let them really stretch out there, and then you're just going to rest them down and push down just a little bit. Now this motion should be pain-free. You should feel like you're getting some stretch with it, but you do not want to feel like you're bothering anything in the neck or shoulders. If it feels painful, do 2 to 3 reps and see if that pain decreases. It could be that the muscles are really tight and that it's causing you a little bit of pain initially, but it decreases after you do a couple reps. That's fine. But if it increases after you do a couple reps, then this is not the exercise for you. This one I like to do usually between 10 to 20 reps until I feel that those muscles are relaxing and actually letting go and letting me be in a more comfortable posture. And the last exercise that I like to recommend, if you've been around the channel for a while, you hear me talking about it all the time, is deep breathing. Making sure we're using that diaphragm to get that deep breathing helps to decrease tension through the neck and shoulders, and it also activates the vagus nerve. And your vagus nerve is your chill out nerve. So when it gets activated, it helps to calm and relax the entire body, really the entire system. So you want to make sure that you are doing a couple deep breaths. And yes, I understand you should be doing this diaphragmatic breathing all day long. That is definitely the goal and the intent. However, in our society today, we don't tend to do it all day long. So you got to set breaks and reminders to make sure to check in and that you're doing that diaphragmatic breathing. In order to do that, you want to make that deep belly breath, breathing in through your nose and out through your mouth like you're blowing out a birthday candle. In through the nose and out through the mouth. I would do 10 to 15 breaths or until you feel like everything's kind of calmed down. You should feel your shoulders soften or melt as you're using more of that diaphragm to get that deep breath. Now, how often should you do these exercises every day? Really, these stretches and exercises are geared towards decreasing tension and making you feel better. So do them as often as you need throughout the day.